आप खुद ही
हाँ
बोल दो।
We are
हाँ
live
मैं
now.
यस यस ओके ओके
Good evening, everyone. I'm Namrita Madesh from MediSage e-learning private platform, a platform for the doctors, by the doctors, and for the doctors for sharing knowledge and professional collaboration. And today, I welcome you all to yet an insightful Medtalk on preconception. We are honored to have with us two distinguished speakers, Dr. Ritu Santwani and Dr. Manjeet Mehta. Dr. Ritu Santwani is a renowned obstetrician, gynecologist, and infertility specialist and sexologist, known for her holistic approach to women's health. She holds prestigious qualifications including MBBS, MD, PCOG, FIAOG, and ART Singapore. She is the founder and CEO of 360-Degree Healthcare Studio NUHS Singapore, a platform dedicated to comprehensive women's wellness, recognized among the top 50 most influential doctors on social media. Dr. Santwani is also the co-founder of MAAM and a board member of SWWC, where she actively contributes to advancing women's health and empowerment on a global scale. Joining her today with us is Dr. Manjeet Mehta. Dr. Manjeet Mehta, a distinguished expert in the field of reproductive genetics. Dr. Mehta holds a PhD in human genetics from Mumbai and trained at top international institutes in UK, USA, and Canada. With over 32 years of dedicated experience in human genetics, Dr. Mehta currently serves as the Director of Genomics at Life Genomics Lab in Mumbai. Experts, we welcome you to the session. And now I request Dr. Ritu to take the session forward. Over to you, ma'am.
yeah thank you Namrita and really grateful to Medisage for providing the platform for such academic initiatives. So friends, today with us a very dear friend Dr. Manjeet Mehta madam is here. Madam is I think madam doesn't need any introduction, though the formal introduction has done. Madam has done enormous work as a secretary for ISPAT. Now she is holding a very prestigious position as a vice president for ISPAT. So, Madam, first of all, a very warm welcome to you because this is a virtual CME, so I can offer you the virtual roses for you. So, really thankful to Madam that in spite of her busy schedule and in such a short notice, she accepted the invitation. So, friends, today we are going to discuss something which is very important, is related to preconception care. Being an infertility specialist, lot of patients who are approaching to us having a lot of queries related to preconception. Is it like that only the folic acid and B12 is important, or the patients who are coming to us who are having a history of the birth of recurrent malformed babies, or sometimes a history of recurrent abortions? So, what is the angle from the genetist? So, for that, we have invited here today the madam. Madam, really, we are grateful to you for your presence. Yeah. So, ma'am, with your permission, shall we start the questions, or you want to say something first about the topic?
Yeah, thank you so much, Dr. Ritu. This is very kind words that you have shared. And I'm a follower of your regular chat shows on this platform. And you are doing really amazing work. I mean, the entire spectrum of topics that you cover for the benefit of all the viewers, it's really amazing. So thank you once again for having me on this show. I think we could start.
Yeah. Thank you. Thank you, madam, for your kind words. So, ma'am, as we have just mentioned about this preconception, so from the genetist perspective, what do you think that how it is important and why it is important?
So, first of all, this is a very interesting topic that you have picked up for today's discussion. The care of the baby at one time, like maybe 30 years back, was when we see an abnormal newborn, and that is when we try to find out what is the abnormality, how did it happen, how to ensure that the couple doesn't have another newborn child. Then the detection and the diagnosis of all these conditions went to a prenatal stage, where once a lady is pregnant, we are able to diagnose certain conditions in the fetus. And today we are at the preconceptional stage. So before the pregnancy is even conceived, we can do a whole lot of tests to ensure pregnancy having a normal fetus. The reason for all these advances is because our knowledge of genetics has also increased over the years. And there are several conditions today we know that both the parents will be apparently normal, so-called perfectly normal. And then they have a child who is affected by some condition. So the so-called perfectly normal couples, could be carriers. We all are carriers of several autosomal recessive conditions. That is the reason why it is really very important to have an intervention at the preconceptional stage itself.
Very true, ma'am. Thank you so much. Because light is flickering, that's why I'm seeing that side only. But the internet modem, I have to change or what. So,
Mm.
ma'am, my next question to you, as you have just explained, so that is now the question comes as lot of corporate sector patients are approaching to us these days for the genetic screening. So, how do you explain in their patients about the carrier screening in non-doctors?
So, see, carrier screening is one such condition wherein the gene is inherited in an autosomal recessive fashion. That
Yeah,
means
yeah,
that both the parents should be carriers of that gene. And that is
correct.
when the child has a chance of developing that condition. So the parents themselves, as I said, they will be completely normal and they will not even know it. I mean, we had a very interesting case of a couple from Indore. They were not related, like it was a non-consanguineous marriage. They were both from the same community, and because they happened to visit an obstetrician who advised them preconceptional genetic counseling and testing, we came to know that both of them are carriers of beta thalassemia. Now we know beta thalassemia has a very high prevalence in certain communities in our country. So then we are able to, screen the baby before, even during IVF or prenatally, and we know if the baby is going to be affected or not. So autosomal recessive condition is something where, in a colloquial language, if you're staying in a hotel in a twin sharing and they give us two copies of the key, if one copy is lost, we can use the other copy and enter the room. But if both copies are lost, we cannot enter the room. It's like that, when the child gets both the defective copies from the both the parents, one from each, then the child will be affected. And the prevalence of these conditions is extremely high. I mean, there's nothing like I don't have any condition, so I don't need it. That's very important for everyone to understand.
Lovely, ma'am. Lovely example you had given. I think really a mind-blowing example. So those, because this program has been attended by a lot of the resident doctors also, very popular among the residents who are doing their MBBS or doing their postdoctorate. So actually they usually join and send us the lot of topics and what topics they want to learn more and more. So yes, really grateful to you. So मैम, is it like that because there is a normal अभी लोगों के दिमाग में ऐसा है कि these all tests are very costly. So what you say is the all genetic testing are very costly or they can be affordable by the middle class people also.
So it all depends on the test. So today there are so many tests available, so many different technologies available. If there is just no family history, we'll need to go in for a larger spectrum test. And typically we advise one of the partners to do the test. Because as I've just said, if both the partners are carriers, then only the baby has a chance of being affected. So this so-called carrier screening test may cost around 15 to 20,000 rupees per head, and one of the partners goes in for it. If they are not carriers, it's perfectly all right. And if they are carriers of any condition, then the other condition that other partner needs to be tested for that condition. If there is a known condition running in the family, then you need to do a specific test for that condition. So that will be something in the range of 3.5 to 5,000 rupees. And today, because of the availability of several labs, the prices are also going down, and the awareness of people is also increasing. Another very important factor that all these future parents have to keep in mind, before considering the cost is the cost of rearing a child with a genetic disease. It could be a birth defect, it could be an adult onset condition, it could be anything. But then the cost of those medications, those special education, that trauma is you can't just put a price to it. So it's better to spend some money now, get it done. Of course, as I said, it's not very expensive, but I think it's really very important that people go in for it. Thank
Yeah. So thank you, ma'am. Yes, very true. As madam has just rightly pointed out. Yes, because of now the lot of labs are doing these kind of tests. So of course the price is getting reduced day by day. And as very rightly Madam has pointed out, I can say this is a take-home message that instead of bringing up the defective child, the lot of special classes, educations, special studies, special care need, it's much better to invest some money for this, the genetic test where they are recommended. So thank you, ma'am. Thank you so much for that. So, ma'am, what you find as yes, I am being an infertility specialist, being doing all the infertility treatments. Yes, we are very easily ready and for the explaining the patient or doing the couple counseling for these genetic tests. So being a genetist, how you found that is it some resistance by the normal doctors who are doing normal OBGY practice or the general physicians? Because these kind of patients with the some birth defects first usually approach to the general physicians. Then from there they are referred to the special obs and gynec, and there from there we refer to the genetist. So how you find in today's scenario, is there is some resistance by the doctors also?
Actually, yes, unfortunately, it is true because, see, the fact is that the knowledge of genetics is also growing day by day because there's so much of research happening at an international level. There is more and more knowledge being available every day. For it to reach every practicing doctor, it does take its time. Many times the doctors depend on some of the service providers for their information update. And to the extent that some doctors, there's this fear of doing the genetic test and what will happen and is there a stigma if we come to know the parents are a carriers, there is no stigma. We are not responsible for our chromosomes or our genes that we carry. Here I would really like to emphasize that counseling is the key. It's very, very important to explain it all to well to them. It's as simple as you check your blood pressure before pregnancy. You ensure that the BP is normal. Because later on there could be other complications. So today genetic tests are available and as easily to everybody. It is really very important to do these tests and the counseling and explaining to them that even if we know that one of them parents is a carrier, there is no fault of theirs. So that counseling is a key here. I would really feel so.
Yeah. So very true, madam. You have very rightly pointed out. And friends, as we all know, our field is like that, that we have to be updated day by day. So now with the help of the chat GPT, with the help of the AI, there are so much of the recent advancements in with the AI in the reproductive genetics also. So yes, as madam has rightly pointed out, we have to upgrade our knowledge, then we can use that knowledge for the benefits of the patients. Now, ma'am, coming to the next question, are there any guidelines from the authorities for these testing? Please put some
Uh,
light on that. Hmm.
Definitely. See, to the extent that American College of OBGYN, they have very emphatically said that expanded carrier screening, which covers something around 600 different genes, has to be offered to all pregnant women. Back home in India, even Foxy has released guidelines, and in fact, they have given comprehensive guidelines on pre-conceptional care. They emphasize the importance of optimizing the maternal health before conception. Preconceptional counseling has to be done to all the women of reproductive age. They also include things like nutritional assessment and screening for infectious diseases and chronic disease management, and genetic counseling is really very important. We see if they belong to a certain community in which we know that there's a high prevalence of certain inherited conditions. We see if there is a family history, we take their pedigree chart, the family history, and if there are any genetic disorders running in the family. So there are very clear guidelines laid down even in India by Foxy. And the aim of the whole exercise is to reduce maternal and neonatal morbidity and mortality by addressing what we call as modifiable risk factors before a lady becomes pregnant.
Thank you so much, ma'am. So, ma'am, you think is there any role of the lifestyle also for these genetic diseases? As these days we are seeing a lot of girls are coming to us very much addicted to the smoking, vape, alcohol, red wine, so many things. Daily I'm able to, I can say I am daily learning one or the new thing. Today only I've learned some new things. What the patients told me that they are not addicted to the smoking. They are taking vape for once or twice. They are taking that हुक्का हुक्का के लिए भी कुछ और वर्ड यूज करते हैं आजकल, वो भी यूज कर रहे हैं, हाँ. So what do you think? What is the role of the lifestyle for these factors, for these genetic conditions?
So interesting to see that lifestyle, like we say that our genes are cannot change; they are with you for life, which is true. Having said that, there is something known as epigenetics, which is the expression of the gene, which means that the way the gene translates into the proteins and it translates into the body function. तो जीन वही रहता है बट उसका वट एवर द आउटपुट इज देयर ना वो बदल जाता है एंड दिस ऑल ऑफ दिस हैपेंस बिकॉज ऑफ ऑल दीज लाइफस्टाइल फैक्टर्स whether it is smoking, poor nutrition, even stress, you know, the genes are turned on or turned off. Epigenetics is a huge science in itself. And we also know folate levels in the mother
True.
are really very important. The mental health is important. And a baby's future risks of diabetes and heart disease when the baby becomes an adult is due to the maternal stress while she was pregnant or while when she conceived. So this is a really very important factor which has to be taken into account and which has to be controlled before they plan a pregnancy.
Yeah, very true. Thank you so much, ma'am, for that. Now, ma'am, coming to a very common queries as the patients who are approaching to us, जैसे यहाँ पर एक बहुत कॉमन टर्म यूज करते हैं, मतिमंद बच्चा या डाउन सिंड्रोम का बेबी. So, so what do you think? What is the role about the Down syndrome? Is there is a myth that Down syndrome can also be inherited? So, what do you say about that?
So डाउन सिंड्रोम जैसे जो बोलते हैं वो पहले बर्थ पे पता चल जाता था. अभी ठीक है, सोनोग्राफी में मार्कर्स है,
True.
एनआईपीटी टेस्ट है, बाकी
Yeah.
मदर के ब्लड से भी
Yeah.
इंडिकेशंस मिल जाते हैं.
True.
देयर आर फ्यू केसेस व्हिच आर इनहेरिटेड. अगर वन ऑफ द पेरेंट्स इज हैविंग अ क्रोमोसोमल ट्रांसलोकेशन इन्वॉल्विंग क्रोमोसोम 21. सी डाउन सिंड्रोम में क्रोमोसोम 21 के 3 कॉपीज होते हैं.
Correct.
बाकी सब नॉर्मल लोगों में 2 कॉपीज होते हैं. सो मोस्ट ऑफ द केसेस आर डी नोवो. डी नोवो मीन्स अपने आप ही हो जाते हैं, इनहेरिटेड नहीं होते हैं. एंड इट्स नथिंग अबाउट द पेरेंट्स. इट इज समथिंग जब भी सेल डिविजन होता रहता है ड्यूरिंग फर्टिलाइजेशन, एट दैट टाइम समथिंग गोज रॉन्ग. And advanced maternal age is one of the factors that plays a role in that. Only few percent is inherited. अगर किसी भी पेरेंट को बैलेंस ट्रांसलोकेशन है, वो क्रोमोसोम टेस्ट करके पता चल जाएगा. Then, I mean, there is a chance that it is inherited, and then there is a increased risk in the next pregnancy. But this is a very low percentage. तो डाउन सिंड्रोम दोबारा होने का चांस तो बहुत ही कम है.
Yeah, very true. Thank you, ma'am, for clarifying this. Ma'am, similarly, the lot of persons who are coming to us that, madam, we are having a family history of diabetes, apart from the gestational diabetes. So, is it like that if the father is having the diabetes or the mom is having the diabetes, you think what are the chances for the genetically inheritance about this?
So diabetes and the whole lot of lifestyle diseases, what we call hypertension,
Yeah.
obesity, this whole package, no, इनमें क्या है ना, जेनेटिक का भी रोल रहता है एंड एनवायरनमेंट का बड़ा रोल रहता है. So if somebody has a gene for developing diabetes, उसको हाई चांसेस है कि वो डायबिटीज डेवलप करेगा. Having said that, if you control your diet, lifestyle modifications, exercise, you may never develop diabetes. Hypertension, obesity, all these are lifestyle diseases. There is a very little role that genes play in that.
Yeah. So thank you, ma'am. Ma'am, related to that only, we have received one question. We have already discussed the first question. You can see, ma'am. If a woman is having the chronic conditions like diabetes and hypertension, how to approach such cases? Madam has already answered for this. Ma'am, coming before to the next question, as we all know, the genetic testing we all recommend or we all heard about since we are learning. So about the neural tube defects. So what do you think the role of the genetic testing for the neural tube defects?
So neural tube defects, we all know, is caused due to folic acid deficiency.
Yeah.
So before the mother conceives, we will ideally 3 months in advance, we should put them on high dose folic acid supplementation. And of course, the doctor will tell you it's around 4 milligram per day or whatever the dose is. Additionally, we should review any medical condition that is there, diabetes, obesity, क्योंकि इसके वजह से again neural tube defects के risk goes high. And then avoid other medications which interfere with the folate metabolism. So there are certain medicines, some of them even anti-epileptic drugs and all, they interfere with the folate metabolism. So those should be avoided, or else you should adjust those doses, asking your doctor for that. Do a genetic consultation, which is important. You rule out any inherited syndromes if there is any family history. And very important during prenatal stage, do a targeted ultrasound, do your AFP levels, do your dual and quad markers. And then if you do a right planning, many families, after having one child with an NTD, they go on for a healthy pregnancy after that.
Correct, correct. Yeah, Namrata, you can take the questions.
Yes, ma'am.
First question already madam has answered. Huh.
Yes, ma'am. So, ma'am, the next question is during preconception, what tests do you advise to male partners or husbands?
So this is a really very important question, and this is actually many times even overlooked.
Yes.
People just keep focusing on the female partner, but then we all realize it's an equal contribution of both the partners for any healthy pregnancy. The male should also undergo to all these tests to ensure that there are no familial conditions which run in the family. They should also check their diabetes, hypertension if they are in control. They have to check their diet. It is very important because the a good pregnancy depends on a good sperm health, and that takes care of half of the story. So a poor diet, it can reduce the sperm count, it can reduce the sperm motility, it can have a low DNA quality, and then this will affect the embryo development. So men should focus on antioxidants, zinc, omega-3 fatty acids, folate, B12. They should have a healthy diet. They should avoid alcohol. They should avoid smoking. They should avoid processed meats. All of these are linked to poor sperm quality.
Yes.
Yeah. As very rightly madam has pointed out. So earlier what happened once the couples are approaching to us, they think that only the female has to take all the supplements and only the female age matters. So now a lot of studies have come out, and as madam has also pointed out, yes, of course, with the male partner also, as the age increases, the chances of DNA fragmentation increases. So we are getting the poor quality of the sperm. Then we will make the poor quality of the embryo. And similarly, as Manjeet ma'am has pointed out, intake of this micronutrients and macronutrients both are important. Zinc, selenium, chromium, vitamin D, folic acid, B12. These all we are recommending to both the partners. So yes, it's very important to go for the testing for the both. Yes, my dear. You can take next question.
Ma'am, how to manage situations like where both partners are found to be carriers of same recessive condition?
So this is high risk scenario, and this is what we have been talking all throughout. And
Yeah.
very good if you have done the testing preconceptionally, and now that you know that they are the carrier, both of them are the carrier. और एक बात बता दो ना, something around 25 years back, we would have advised such couples not to get married or not to have their own child to that extent because itne genetic tests develop nahi hue the at that time, this is like maybe 30 years back, but today there are all possible tests available. So one part is a you go in for an IVF pregnancy, and you go in for a pre-implantation genetic testing. Now you know which mutation you are looking out for, you know which gene, which mutation both the parents have. So you have to look out for that in the embryo. This is expensive, but the advantage is that lady doesn't need to go through that pregnancy. And the other option is that prenatal testing. So if she has a spontaneous conception, then first trimester, we take out some little bit of chorionic villus and we test that for the two mutations that both the parents are a carrier of. There, unfortunately, if the baby is found to be defective or having both the mutations, then we suggest termination of pregnancy because this child is going to be affected. If the child is carrying one mutation and not the other, perfectly all right, because that one will be a carrier like the parents. So some people don't like to go through this entire cycle of, getting pregnant, waiting till
Correct.
8, 9 weeks. Then if it is a positive finding, then having an MTP. So then the other option is IVF, but it is expensive. So it's up to them. But they definitely, every pregnancy needs to be tested for this couple.
Yeah, very rightly you have pointed out, ma'am. Yes, as you have earlier said also, yes, the couple counseling is the must. Once we explain them everything, so for that the practitioner has to have some little more time. Otherwise, they have to keep one counselor because in the busy OPD for all these things you have to clarify up to the great extent because in this today is the era of the CPA. So in that time, yes, we have to be very, very careful for everything. So thank you, ma'am, for clarifying all these things.
Yes.
I think next question, madam has already taken the carrier. Huh? So now take the last question, my dear. Huh?
Yes. Ma'am, what's the biggest myth you encounter about genetics in pregnancy planning?
So myths, there are many. I tell you, so if we say that coming back to this example of beta thalassemia, if both the parents are carriers, there is a 1 in 4 chance of them having an affected child. There is a 1 in 2 chance of them having a carrier, and there is another 1 in 4 chance of them having a normal child with both alleles are normal, because both the parents say one mutation comes. So you get the mutation from one parent or both parents. So some people feel कि एक affected child हो गया तो अभी बाकी के 3 बच्चे normal होंगे. So it doesn't work that way. Every pregnancy has a 1 in 4 chance of being affected. So that is one thing people need to understand I know we tell all the statistics to the parents, they also get confused. So we have to bring
True.
it down to their language. अगर
हाँ.
हम बोलते हैं कि 1 in 4 चांस है तो हाँ 2 तो बच्चे अफेक्टेड हो चुके हैं, अभी तो थर्ड नॉर्मल होगा, कोई टेस्टिंग कराने की जरूरत नहीं है. So this is some myth that people have. Some of them also say that only elderly couples can
True.
have
This is a very, yeah, this is a
abnormal
very
child.
common. Yeah, yeah.
Young couples, primary, first pregnancy, you get a Down syndrome. So you have to test every pregnancy. You have to ensure everything is right in every pregnancy. So yeah, myths, there are a lot of them floating all around.
Yes, ma'am. So,
Yeah.
ma'am, the last question we have is what role does stress and mental health play in preconception?
A huge role, a huge role. I'm
Mm.
telling you, the child sometimes is born normal, but the child later on develops things like autism, obesity, heart disease, only because of maternal, preconceptional, prenatal stress, tension, maybe diabetes, those things like that. So it's really very important that you have a very cool temperament, optimal conditions, good health physically, and a good health mentally. It's really very important. I understand a lot of pregnancies, especially the first pregnancy. They're not married for very long, maybe 3 2 3 years, within 5 years of marriage, in-laws, new home, adjustments, stress. The couple needs to understand that they have to play it cool. They have to take it all in their stride, because the future of their not yet born baby depends on that. It's really very important to control it. Yeah.
Very true, ma'am. So yes, stress plays a role in everything. So yes, हमें खुद भी डिस्ट्रेस होना है, क्योंकि हम डॉक्टर से इतने स्ट्रेसफुल रहते हैं आजकल के सिनेरियो में, तो पहले हमको खुद को भी डिस्ट्रेस करता है. So that is a very important point. Yes, I think all the questions are over.
Yes,
Yeah,
ma'am.
and we have finished on time also. That's great.
Yes.
Yeah.
So yeah, thank you, Manjeet ma'am, once again. Before the Namrata will do the official closure. So thank you once again for taking out your precious time, and thanks to my lovely audience who are joining all across the geography. So friends, on next week on 27th, we are having a wonderful discussion on menopause and diet. So please do log in. Further more programs are lined up. We will announce very soon. Yeah, over to you, Namrata.
Yes, ma'am. Thank you. So
Mm.
we thank Dr. Ritu Santwani and also Dr. Manjeet Mehta for an insightful and eye-opening session on preconception. And to our viewers, thank you for joining us. We hope this Medtalk has enriched your understanding and sparked important conversation around patient education and dietary guidance also. So we thank you, ma'am. Thank you for your time.
Yeah, thank you for having me over. It's been really very enjoyable. Thank you, Dr. Ritu. You're really
Most
doing a
welcome, ma'am.
great job. Yeah, you're really doing a
Most
great job.
welcome, ma'am.
Yeah,
We are honored to have you with us.
yeah.
Bye bye. Bye bye.
Okay,
Good
thank
night.
you, everybody.
Good night.
Yeah.
Thank you.
Good night. Good night.